My name is Buck Black, and I'm a therapist in Lafayette, Indiana, and I wanted to speak with you a little bit about depression. Common signs of depression are headaches, feelings of hopelessness, lack of energy, irritability and anger, lack of concentration, and feelings of wanting to hurt oneself. It's important to look at if a person is coming into the office for depression. We need to take a look to see if bipolar disorder might be the cause. Often, bipolar disorder is overdiagnosed, so it's something that I'm very careful with. However, we have to look at, is there a mood swing, so is there depression and then mania, or is it simply depression? So sometimes people focus on the depression and the mania is ignored. So mania is simply excessive energy, irritability, maybe inflated ego that gets oneself in trouble. It's important to take a look. If that is the cause, then nonetheless that is treatable. Comorbidity. If you look at any person that is dealing with some kind of particular challenge in their life, usually they're dealing with more than one challenge at the same time. So for example, someone with depression often has ADHD or anxiety, they're wanting to hurt themselves, maybe they're cutting on themselves, maybe they have family problems, maybe that's adding to their depression, maybe they have a history of trauma or some other chaos in their life. So that's definitely something to look at, and therapy addresses those other issues along with the depression. A lot of times people have depression in ways that don't really appear to be the behaviors of one that is depressed. So for example, maybe the chief complaint is inattention at home, work, or school. Maybe the person is angry for no apparent reason, or they just anger quite easily, or they're just simply not that social. A lot of times when someone fits this category, I explain to them that it looks like they're dealing with depression, and then they say, but there is no sadness, I'm not crying, I'm not isolating myself, I am able to get out of bed in the morning and function. It's important to point out that depression is not necessarily just the classic signs that we've talked about earlier. On the other hand, there are things that mimic depression, but it's not necessarily depression. So if we look at bereavement, grief and loss, that is typical. That's natural to go through that. And it might be the death or the loss of a person, or just something that's very important to you. Another thing that we can look at is the most minor diagnosis, and that's called an adjustment disorder. And typically what that is a difficulty adjusting to a change in your life. And that adjustment process is less than 6 months. So the problem persists less than 6 months. And therapy is still helpful for that, to teach coping skills on how to deal with, maybe you've moved to college and you're feeling sad, maybe you've changed jobs, changes in the family, that kind of thing. I think that it's very important to listen to depression before we jump to say, okay, depression is the primary problem. So it's looking at what is the root cause. You know, is it something environmental? Is it prolonged grief? Is it substance related? Is it related to past abuse? Is it part of your genetics? There could be a variety of things. So it's very important to look at where that depression is coming from. And then again, talk therapy helps the person to change their thinking, change their behaviors to deal with this depression. Now, I do need to say that since I am a therapist, I am biased, and I often want my clients to do therapy first before we look at any kind of antidepressants. So if a person is in therapy and they don't have a whole lot of change after a handful of sessions, then often I make a referral to a medical doctor to get the person assessed for an antidepressant. If the person needs an antidepressant, then it's also important to point out that studies have shown that doing therapy along with your medication is the most effective. So that's a really important point to keep in mind. I want to add that if a person is feeling suicidal or homicidal, so if they're going to hurt themselves or hurt someone else, please get help. You can call 911, you can go to the emergency room. It's just really important that you reach out and that you get help immediately. I want to leave you with the idea that depression is treatable. There's talk therapy, there's medication, and then just simply exercising, changing your routine. Those are all huge things that can be done. So I definitely ask people to reach out for help if they are feeling depressed, or if they have a loved one that they're afraid is depressed as well. Thank you very much.